Good afternoon, and thank you for joining us today for our webinar, Privacy, Big Data, and Staying Safe. My name is Stuart Beck, and I'm happy to be here in sunny British Columbia. And we are co-hosting this event today in partnership with the Consulate General of the Republic of Korea in Vancouver. Before I turn the floor over to our Consul General, Byung-won Chung, my good friend, I'd like to take this opportunity to acknowledge that the places Canadians call home are the traditional territories of many First Nations, Métis, and Inuit. I would also like to go over a few housekeeping rules before we start. This webinar is currently being recorded, but there are no media present. Please use the Q&A function at the bottom to send us your questions during the presentation. We will do our best to answer your questions during the discussion part. Should we run out of time, please feel free to reach out to us online. And for technical support, please contact events@asiapacific.ca. We have scheduled an hour for this event. Now I'd like to introduce Byung-won Chung, the Consul General for the Consulate General of the Republic of Korea here in Vancouver. Consul General Chung is a graduate of Seoul National University and has served for South Korea's Ministry of Foreign Affairs since 1990. During his career, he has served as the director of the Japan Division and Northeast Asian Affairs Bureau. He's been Minister Counselor at the Korean Embassy in Germany and Director General for Northeast Asian Affairs before coming to Vancouver. Without further ado, I would like to ask Consul General Chung to say a few words.
Thank you, Ambassador Beck, for your kind introduction. First of all, I would like to welcome all the participants to join today's webinar. And also I would like to express my sincere gratitude to President Stuart Beck and the staff of the Asia Pacific Foundation of Canada for preparing today's webinar. The outbreak of COVID-19 has altered the world, and these unprecedented times has brought the world together to try to find out treatment and solutions to fight this disease. As you may be aware, South Korea was one of the first countries to come into contact with the virus, and since then has become a global leader for successfully containing the disease through extensive testing and treatment with the use of technology. This technology strategy, test, trace, and treat, has been effective throughout South Korea and serves as a good example for other countries currently battling outbreak of COVID-19. However, this successful strategy has also raised questions over privacy implications and data collection. To address these questions, we have invited two leading privacy experts to lead the discussion today. And I believe they will provide us with an interesting and robust perspective on this topic. I also believe you will see that the Korean experience demonstrates that digital technology can serve the public health policy well, while appropriately safeguarding the privacy of citizens in the era of big data. Once again, I would like to welcome you to the webinar, and I sincerely hope that all the participants will benefit from the interesting discussion we hear today. Thank you.
Well, thank you very much, Consul General Chung. And now it's my pleasure to moderate a conversation between these two leading experts. And I'd like to introduce Professor K.S. Park. K.S.'s area of expertise is freedom of speech, privacy, neutrality, and digital innovation. He's currently a professor at Korea University Law School. K.S. has served as a commissioner of the Korean Communication Standards Commission in the past. In addition, K.S. co-founded and serves as the executive director of OpenNet Korea, an advisor to groups such as the Global Media Freedom Initiative, High Level Panel of Experts, Global Network Initiative, and Freedom Online Coalition. Also today with us is Carol Piovesit, and she's a partner and co-founder of INQ Data Law, where her practice concentrates on privacy, cyber readiness, data governance, and AI. Carol was formerly a co-lead of the National Cybersecurity, Privacy, and Data Management Group at McCarthy Tétrault. Carol serves as co-chair of the Data Governance Working Group for the Data Governance Standardization Collaboration at the Standards Council of Canada, bit of a mouthful, a member of the Task Force on AI for Health at the Canadian Institute for Advanced Research, CFAR, an advisor to several domestic and international organizations across public, private, and civil society sectors. In 2018, Carol was appointed by Minister Navdeep Bains of the Canadian government's Innovation, Science, and Economic Development to serve as one of the 6 digital leaders in the National Data and Digital Transformation consultations, which led to the creation of Canada's Digital Charter in May 2019. So we'll have our first presentation from KS, so please, now over to you.
Thank you for the introduction. Okay, the slides are up. Thank you, Consul General, and thank you, Asian Pacific Foundation for organizing this event. Korea is just about the only major country affected by COVID-19 that has neither closed its borders to any country, nor has imposed long-term general lockdowns in any geographical area. How was made this possible? What does Korea have that other countries do not? Let's look at Section 76-2 of the Infectious Disease Prevention Act of the country. That allows comprehensive location tracking of patients, possible patients, those who came into contact with the patients, so contactees, and possible contactees, all without their consent. Why is this significant for prevention purposes? People have pointed to massive testing as a reason for Korea's success, but such massive testing is possible only if the government can force people into testing. Now, other countries have same mandatory testing law. What Korea has that others do not have is the tool to find out who to test. So the postulate here is that this non-consensual, non-judicial meaning it doesn't require a warrant from the court. This non-consensual, non-judicial location tracking of patients and possible patients allowed identifying early worthwhile targets for testing. So if a patient was found in a building and there were 500 people working in that building, all of them will be forced to go into testing. That's how Korea has increased a number of testing and how the massive testing was possible. So far, most of the concerns with Korea's privacy was on public disclosure, like disclosure of people's movement. Sometimes disclosure of too much information about a known person, often stigmatizing information. Other times, disclosure of the very identity of the patient. Now, these are all valid concerns, but Korean government has progressively reduced the granularity and re-identifiability of the information disclosed without reducing people's ability to avoid high-risk areas. Now, disclosure is not so relevant to Korea's trace, test, and treat strategy, which requires a lot of information to be first acquired by the health authorities. The more focus should be on whether Korea is doing the right thing from human rights perspectives in acquiring the information, and whether it will be the question, logically next question is whether it will be also the right thing for other countries to follow suit. Now, MIT recently reviewed 26 contact tracing apps other than Korea's, but these apps work prospectively, meaning it does location tracking going forward. They start producing meaningful information only after the government identifies the patient, or after the patient voluntarily identifies himself, him or herself as such. But is that too late? Korea's law allows retrospective tracking. So allows to mark out high-risk areas and high-risk people that existed even before knowing of any patient. Also, all these apps are voluntarily installed, except in the case of India and Turkey. Korea's law works despite the patient's and contactees' will, making possible acquiring accurate location information. Now, this is all a postulate, but we have to look into it. Before praising Korea's case as success, we must point out that people's privacy are at stake. Probably this is just about the only law in the whole world that allows non-judicial, non-consensual location tracking during ordinary times. And Korean law suffers from other flaws from human rights perspective. For instance, acquiring even credit card records, hospital records. But before writing this off as the rise of state surveillance, we also should point out that there is no clear international human rights standard on surveillance for non-criminal purposes. Finally, I mean, it's easy to call, it's easy to look at Korea's case and just call it a cultural phenomenon possible only in Asia. But we should be mindful that given the hyper-contagiousness of COVID-19, no country will be safe from it unless the whole world is safe from it. We cannot prolong border shutdowns, lockdowns into eternity, which will force people into a choice between starvation and infection, and we must somehow find a long-term sustainable balance between privacy and health. This non-judicial, non-consensual location tracking, section 76-2 of IDPA, was a response to the 2015 MERS outbreak. And as you know, Korea was the only country hit big by MERS outside the Middle East. Actually, it was the runner-up after its origin, Saudi Arabia, in front of distant thirds within most Middle East countries. So some people wanted to name a course outbreak instead of MERS. There, the failure to track one patient, one patient and alert people ended up infecting a large number of people, killing close to 40. The demand for accurate information, accurate location information was very high. Back then, the government refused to disclose that information to the public, worrying that it will stigmatize hospitals and establishments that the patient has visited, and wanted to protect those entities from panic responses from the people. But it showed that the government ended up disabling many people from taking precautionary measures. And what you see in the slide is the unpublished statement of Korean Society of Infectious Diseases, which is the mainstream association of epidemiologists of the country. And the lessons there is that there has to be full disclosure of all contactees, despite side effects such as panic responses from the public, tracking all patients and contactees, and leadership should be not with political appointees, but with the experts on epidemiology. And the statement ends with a promise that they will contain MERS if these three things are given these three things are changed. So this is the extent of information collected by the current law. So mobile phone carriers give location data, immigration services, police give CCTV footage, credit card companies to pin down exactly which shop the patient visited. Public transit companies show transit pass records. Government agencies give accurate personal identification information, and also prescription medical records in case the patient or the contactee has visited any of those clinics or pharmacies. And all those information are shared with Korea CDC, police, Ministry of Health and Welfare, and you can see how extensive the information is being, and these are the information that were asked for during the MERS outbreak. So you can say that MERS outbreak became kind of a vaccine in terms of how the Korean system has improved, if you want to call Korea's case success. So let's look at the data. Korea has a population of 50 million. Now has tested only about 1 million people, but has contained the outbreak down to less than 100 new cases per day. Compare that to the US, has a population of 300 million, which is only 6 times, and have done 20 million tests, but the outbreak is still not contained. So we tend to think that Korea has done massive testing, but now you can see the numbers. The US have done even more, but the outbreak is still not contained. What's the problem? Maybe the tests are too late. Korean CDC and WHO guidelines do not recommend testing people without symptoms. But as I said, people, there are many tests of asymptomatic people in Korea. If a patient is found to have visited one building where 1,000 people were working, all 1,000 will be put to test without any symptom or without any diagnosis. There are so many tests on asymptomatic people that even getting the statistics is possible. I mean, it is impossible. Now, we all know now that asymptomatic patients are infectious, and there's a high proportion of asymptomatic patients, and all of them can be infectious. And look at the numbers on the right side. So if you look at the far right, you can see in which countries the outbreak has been relatively contained and which country it has not been. And look at the numbers in the middle, the total test per 1,000. We think that Korea has done massive testing, but Denmark, Italy, US, New Zealand, even Canada have tested more than South Korea, but South Korea has done better in terms of containing. So what does it mean? Maybe it's not the quantity of the test. Maybe it's the quality of test. Maybe it is about how early you need to do the test. There are easy problems to point out in the Korean system. For instance, the police is the intermediary of all this data collection that is more invasive because obviously police can investigate you for unrelated crimes, and also the bodies conducting surveillance are not just health authorities with a neutral interest in public health, but even elected local government chiefs who serve majoritarian constituents who tend to serve the interest of majoritarian constituents. They also can order surveillance, which means there is really no independent judgment on balance between public interest and privacy. And also targets are not just patients and possible patients, but also contactees and even possible contactees. Also data to be accessed you already saw the scope of how extensive the scope of data is. Now, the harder problem is the idea. I mean, even if we fix all those problems, the harder problem remains whether this non-judicial compulsory access to location information should be allowed. So I try to look everywhere to look for an international standard on this. I couldn't find any, except that the US Supreme Court has accumulated some precedents on administrative search. So the idea is that you can do search and seizure on people without warrant, against their will, for specific administrative purposes. And about 3 rules of thumb percolate from the precedents. The first is that such warrantless, such non-judicial, non-consensual administrative search is more allowed in closely regulated industries like firearms, drugs, and mines industries, but it's not allowed in building code inspection and occupational safety health inspection and hotel guest inspection, which is done to not so closely related industries. The second rule of thumb is that binary search is more allowed than search for more substantive information. So DUI check, so drunk driving check, airport check, they look for specific things. Yes or no, are you drunk or not? And whether you have a dangerous thing on you or not. So that's more allowed for administrative purposes. And administrative search should not be covered for criminal investigation. Now, these precedents don't help much in evaluating what Korea is doing, because what Korea is doing is not binary. You are not just checking whether the person has visited a certain place or not. It is substantive information about the person's movement through a few days. And it doesn't concern just closely regulated industries. It just concerns everybody. Yes, it's not related to a criminal case, and there is no evidence that the government is using it for abusing it for criminal purposes. So it's hard to check. It's hard to check whether the U.S. Supreme Court standard is consistent with what Korea is doing. Now, next slide, please. We need to think about this because in Korea, people have accepted more or less this non-consensual location tracking. So the government is doing more. For instance, Korea has implemented a new rule that requires high-risk areas such as dance clubs and karaoke to mark their customers electronically with a QR code, so that if any patient is found there, they can be identified. If any patients found there, all the visitors to those establishments will be forced into testing. Well, the government is saying, well, what's the alternative? We are not shutting down the clubs and karaokes. This is a condition for not shutting down clubs and karaoke. So this is at least better than shutting it down. And also, you all know that Korea has continued with imposing 14-day mandatory quarantine for anybody entering the country, during which you must be under surveillance via location tracking app, which will be required to be installed on your phone immediately upon entry. The government is saying, well, what's the alternative? The alternative is shutting down the border. At least this is better than not entering the country at all. So these are really difficult questions, but the government is forging ahead with these systems because of the supposed success that it has with non-judicial non-consensual tracking. Now, I know that most countries will not even think about adopting Korea's law. The only exception I know of is Israel. Now, I respect that. But if so, please let us know what you think about Korean law. As I said before, we are all in this together. You cannot just sit back and just let Korea do what Korea does best. Korea will suffer greatly from long-term lockdowns. I mean, Korea will suffer greatly later because other countries cannot continue lockdowns forever, and the virus may come from those other countries sooner or later. And there has to be greater coordination because no country can be safe alone. If this is really, if what Korea is doing, it really violates the international human rights standard, maybe Korea should stop putting on a show for the whole world. Maybe Korea should stop this unprecedented non-consensual, non-judicial location tracking. I mean, it's not that it looks bad. It's just that it will not mean much in the long term because no country can be safe alone, and we are all in this together. I think I'm way beyond time. I'll stop there. Thank you for listening.
Well, thank you very much, Professor Park. Again, fascinating presentation, and I think there's some interesting questions we might ask you about this. Now I'd like to turn it over to Carol, and that's very looking forward to what you have to say as well, Carol. Thank you.
Great, thank you. Thank you to the Consul General, to the Asia Pacific Foundation, to Professor Park for joining, and to all of you for joining us today. I 100% agree with you, Stuart. That was a fascinating presentation. There are so many different parallels to draw from. And I think the ultimate message of no country will be safe alone, so let's talk about this, what does it look like, is critical. So thank you so much for that presentation. Let me give you a little bit of Canada's perspective. In the last, Canada only very recently has endorsed a particular contact tracing approach. In fact, it was only Thursday or Friday of last week where the Prime Minister announced the approach. But let's go back for a moment and just talk about contact tracing. Contact tracing is not a new tool in the toolbox of a pandemic or an outbreak, a public health outbreak. Contact tracing has been used before. It has been used manually. In fact, presently, it is being done manually in Canada, where you have somebody call up. If they have a public health concern, they will call into a particular number, and that person will try to help trace where the particular affected individual may have been and contact those that may be around them. So it's very manual, labor intensive, the data recovery is quite poor, but it is a process that we have used before and has been very accepted and successful because of how you, in part because of how you can contain that data. But in certain outbreaks, we have seen the use of technology to assist with contact tracing. And now, as Stuart said at the outset, we are facing a really unprecedented situation where you have a global pandemic with a highly contagious virus that we have never seen before. And the question becomes, how do we effectively respond? Technology has played a critical role in the identification, response, and tracking of the coronavirus. I credit a Toronto company here, Blue Dot, that was one of the first companies to identify the spread of the major outbreak in Wuhan on December 31st, 2019, by analyzing massive amounts of travel itineraries, of travel data, anonymous location data, as well as other individual points, and identified that there was a massive risk to the spread of this virus outside of Wuhan, which in fact obviously did happen. So technology has been used to identify how the virus is going to spread, and then try to identify where there are clusters that are popping up in response to the virus. And that will continue to be the case. So what I really want to emphasize here is that when we're talking about contact tracing, we are talking about one tool. We are not talking about the only tool to fight this virus. It is one tool to attempt to contain and fight the virus, and that is what is so critical. The other areas where we're seeing technology being adopted is really in the treatment and vaccine development for the coronavirus. And frankly, what we find is that 2030 is being pulled into 2020, and what we thought was going to be the digital economy of a decade from now is fast and furiously here. So what we are talking quite a bit about when it comes to the management of the coronavirus in the use of technology is not only what is the technology that is available, but what are the governance structures around that data that's being collected that will help build trust. So let's just stop on that point for a second. Trust is a really critical thing in a democracy like Canada's. Our governments provincially, federally declared emergency orders at various points. Provincially here in Ontario was mid-March, where there were a number of emergency orders declared. And as a data privacy lawyer with a number of colleagues with deep expertise in healthcare, the first question we got from many of our clients was, well, what does this mean? All of a sudden now we have the ability to collect different kinds of data that we didn't have before. We can collect it. Where do we store it? How do we store it differently? And then what do we have to do with it? What if that data that we collected under emergency order, once the emergency has passed, what do we do with that data? Do we have to delete it separately than we would other data that we collected in the ordinary course? Or can we commingle it with that data that we collected in the ordinary course? And generally speaking, our answer was, no, you got to keep it separate because you collected it under the auspices of an emergency, and you can only use it for the purpose of that emergency, and then you must delete it once the emergency is over. But you can see what kind of challenging overlap and challenging structures are put in place in record speed with no notice to try to manage all these different factors and all these different data points. And we're going to come back to this issue of data points towards the end when we're talking about some of the policy discussions. And I think, again, Professor Park did a great job at outlining what some of the really challenging, crunchy issues are from a policy perspective, offering a very different perspective than what we've heard in Canada in particular. So let's go back to this idea of trust. When the Prime Minister announced the contact tracing app that would be favored and adopted by the federal government, what we heard was that the Prime Minister, that Canada would be adopting the Google Apple API with an app that had been designed by Shopify engineers on a voluntary basis and by BlackBerry for the purposes of security. And there were a few really critical messages that the Prime Minister said. Number one, he basically said it's a set and forget type system. So you can get it on your phone, and it will, using Bluetooth technology, it will identify the people in your area on an anonymous basis. It will log the information of the people who have been surrounded by you. And then if there is a positive test, it will sort of ping those various people who had been in your remit for, I think it was 14 to 21 days. And then once that period of 14 to 21 days ends, the data is deleted and actually never leaves your phone. So the model is decentralized, meaning the data doesn't leave your phone to a central repository. It is decentralized. It is Bluetooth enabled. It is using anonymous data, so it's never tagging individuals. And then the last piece that's really critical is that it is totally voluntary. So contrary to what we've seen from Professor Park's presentation, Canada has adopted a totally voluntary system. And if contact tracing is to be effective, the question is always, well, how many people do you need to participate in this system in order for it to be effective? Conventional wisdom 3 weeks ago, as is the case in these unprecedented times, was somewhere between 60 and 80%. Today, it seems like that number has changed. It seems like that number could be much lower. And I'm not an infectious diseases expert. I don't know the answer to the question, but clearly the government is trying to encourage Canadians to download the app and to use the app for the purposes of contact tracing. And so trust is critical. How do you get people to believe that what the Prime Minister has said is true, that the data will not be used in a manner that was not expressed at the time that we were downloading the app or informed about the app, that it will be deleted as the government has said it would be deleted, what are the structures you need in place to build that trust, to get people to voluntarily sign up? And I think people will voluntarily sign up if there are those trust mechanisms in place. I think we can use the carrot and not the stick in a country like ours where privacy is a quasi-constitutional right. So we do need that uptake. It's critical. We need a strong governance structure in place. There are a number of suggestions that say we need external peer review of the system on a regular basis with regular transparency reporting so that the public can feel confident that the government and that those that are involved in the app are doing what they say they're doing, and that ultimately Canadians will participate. So now on this final point of the policy decisions, now I couldn't agree with Professor Park more that these are very challenging policy decisions. Just think about the fact that we have all of this data that we will be collecting in real time, that could be collected in real time, that used with sophisticated advanced analytics or artificial intelligence may identify insights for us having to do with this virus that we otherwise would not be able to spot. But here's the thing. We've decided not to go that route. We've decided that we are going to fight this virus on a decentralized basis and try to persuade people to do the right thing, meaning stay home under lockdown, do not interact in groups. Now in Ontario, it's more than 10. Sign up for the contact tracing app. If you go inside somewhere, wear a mask, wash your hands regularly. So we are going to train people to do these various mechanisms or measures to help promote public health and public safety. We're going to do this through education. We're not going to do it through any type of law enforcement. And I think this is really important for Canada. We're also applying certain measures like quarantine. So I can tell you my brother has traveled to Toronto from California. He is now in a condo somewhere by himself that we rented, quarantining for 14 days before he's allowed to come out and see the rest of us. And that's just the way it is. He's going to have to register with RCMP. So far, there have not been any touch points with him, but I understand that in places like BC, RCMP has checked up on people who are subject to a quarantine. So that's one measure that we have decided is an acceptable measure, given the severity of the situation and the rapidity of spread of this disease. We have distinguished ourselves from other countries for sure. In the example yesterday, I was on a webinar with a gentleman who was from Israel who was talking about their contact tracing app. And the thing that I thought was really fascinating, Israel being a democracy as well, and something I thought was really fascinating is he said, you know, at a certain point, the government started to pull back this app and hasn't really used it since because there was so much blowback on the invasiveness of this app. So when we think about how are we going to do this together, I couldn't agree more with Professor Park that we are not in this alone. We cannot be in this alone. We have embraced globalization for the past 2 decades and more, but so the flow of individuals and goods is critical. So how are we going to do this when our systems are so very different? I think there is a way. I don't think we all have to adopt the same measures. I think we will do it differently, but we can learn from each other to see what works and adopt those certain characteristics that may work in another jurisdiction, in another culture, and see if we can import some of that here. So an example is the quarantine of 14 days. We can do that here. That is acceptable, and it's not a great infringement on Canadians for as long as we are in the state of emergency. But in time, we'll see an easing of that, obviously, as we get a better handle on this particular virus. So there are very, very challenging policy decisions. It's often pitted as privacy versus public health. We've seen this debate not only in Canada, we saw it recently in Norway, as they were really struggling with the contact tracing app that had been adopted locally, with privacy advocates in Norway throwing up their hands saying, this is far too invasive. The spread is not as rapid here, or our numbers are not as high here. We should not be adopting an app like this. And public health advocates saying, this is a highly contagious disease. We need all resources available. This is an effective resource. As last I heard in Norway, they were no longer using the particular contact tracing app that was so controversial. Here we'll have to see. The app is not yet available. It will be available in the next week or so, and we'll have to see what the uptake looks like, and then what the government will have to do to incentivize greater uptake. But I am relatively optimistic that there can be more of a carrot approach here in Canada to educate people to download the app if they have a smartphone, if not to incentivize ways to get smartphones into the hands of people who want to participate in this program, and then see what the response is. And this is a really interesting, I suppose is the best word, example of how we can try out different systems and see what works in different cultures. So with that, I will thank you very much for listening to this presentation, but also invite questions. This is a fascinating debate. There are no clear answers. And it is very much on a spectrum of sort of what is acceptable at various points based on various perspectives and depending on what your toolkit looks like. Thank you.
Great. Thanks so much, Carol. Really appreciate that. Lots of great, great information, lots of food for thought. And I think I might just ask you at the outset here, based on what KS has said, Professor Park has said, and you mentioned the cultural differences that exist. How would you, as a Canadian expert, how would you assess the Korean approach and the impact on human rights and some of the privacy issues that you are looking at from? I know it's a difficult question, but I'd be curious to get your views on that.
Let me answer it a little differently. It's far too difficult for me to look into a culture that is not mine to try to understand a system that I don't. But let's take some of the examples and just bring them here and see if they'd work. So as Professor Park was talking, I was thinking, I can't imagine having credit card info, like very sensitive pieces of information in the hands of law enforcement for the purposes of contact tracing. Like the blowback would be pretty intense here, and I could immediately sort of envision sort of a reference to, a constitutional reference to the Supreme Court or something along that line, a court challenge that this is unconstitutional, that it is a great invasion of privacy on the part of the federal government. I think the way, it arguably could work, but would have to fix some kind of emergency order, which would feel very invasive and very punitive. So I don't think that would be a great approach, but that would be your best way to do it. And then you would, the only way to sort of soften it would be to put in place very, very, very clear guidelines as to how the data will be used and ultimately deleted, and then hope that placates the privacy advocates, which I'm almost positive it would not. So I think it would be a very difficult model to bring here. We are not comfortable with that level of state surveillance, and our charter has been very clear that there should be delineation between what the state can access for individual rights and freedoms, even, I would argue, in emergency times. So I don't think the case has been made yet that you need such great state surveillance to contain the spread. Canada has decided that we are going to go under lockdown, which we have all been for what feels like 100 weeks. We are going to go into lockdown, and we would rather risk the economic blowback than the overall sort of policy context of privacy and invasion of our constitutional, quasi-constitutional rights, because to us, that is a better trade-off. And so instead, the government has doled out a huge amount of money to try to keep us going during this period where we're under lockdown, and has not imposed mandatory contact tracing like what we heard from Professor Park.
So Professor Park, just as a bit of a follow-up on that, you said that we're all in this together and we all have to kind of fight this together. And so the Canadian approach, which is much more decentralized, is that actually going to solve the problems as we go forward over the next 10 years, or next 10, 15, 20 months, however long this is going to take for us to get through this? And this is a challenge I think we're trying to cope with as well. So just your thoughts on that. Yes.
I'm not an epidemiologist, but I think, well, there is this philosophical concept of confrontation. The idea is that if you are not confronted with something, what you do, moral evaluation of what you do changes whether you confront the risk or the harm or the benefit, whatever that affects moral evaluation of your conduct. For instance, passing just walking casually past someone begging for money on the street, maybe more maybe morally more burdensome than say not helping, not putting that $1 bill into a UNICEF fund that is supposed to feed 10 kids in Africa, because you are not really confronted with hunger in the other continent, but you are confronted with a hunger, on street. So yes, I mean, as a fellow lawyer, I would love to get a list of precedents out of the Canadian Supreme Court that will have a bearing on the evaluation of Korea's system. But I mean, let's look at a few months down the road, a year down the road, when we are reopening. Now we are reopening, and we already see what's happening with the U.S. as some of the states are opening. It's going out of control. The outbreak, once that was contained, is now again increasing. California just hit 5,000 new cases a day just yesterday. I mean, it's been only a few days that we reopened. So when we are confronted with, I mean, many people, many governments do not go into action before they actually are confronted, like right in their face, the risk that they know are certain to come to you. As you know, many countries have not taken drastic actions in the early days of the outbreak and are now regretting it. And I was thinking, isn't there any way to really kind of, I mean, there's a term hindsight, not hindsight, but foresight, put people in the eyes, in the situation where they are actually confronted with the risk that they're supposed to fight back. So we'll see. I mean, again, this is really unprecedented crisis. I'm really split. There are governments after governments that have regretted not taking drastic actions.
So
can I add something to that, though? Can I just add?
Sure, absolutely.
Just on the Canadian context. So just because I've been monitoring some of what's in the chat, and I want to address some of these questions. The idea that it is privacy versus something, whether it's innovation, whether it's public health, that the two are pitted against each other is false. It is not one pitted against the other. We have to get over that. Where we have to get to is that we must force our, whether it's industry, whether it's other governments, whether it's our individual citizens, we have to force them to think creatively about how they are going to respond. So for instance, if we are looking at, and first of all, I love what Professor Park said when it comes to this, the philosophy of confrontation. I think he's 100% right. Until it's right in your face and you're dealing with it because your family member can't go to the hospital because of COVID and they just don't have access, or they're, until you feel it personally, it feels a little like a nuisance. But when you do feel it personally, you start to think about, what would I do? How could this be different so that my life doesn't have to be so profoundly affected by this? And I can speak personally from that. So, but I'm not willing to give up. I'm not willing to have the state have pure access to my movement at all times. I'm not willing for that. Whereas it used to be with the manual contact tracing, it was very disjointed. Right now, there's a cell phone that I carry with me everywhere that could track every movement and every person that I speak to or interact with. It really can be quite ubiquitous, and I'm not willing to do that. What I am willing to do, though, is invest or support creative ways to get our companies and our industries back in motion. So reopen responsibly. British Columbia is a province that has been credited for doing this very well. Your chief of public health has done a great job. She has been very outspoken about how we can reopen carefully, identify clusters, shut down those clusters, and continue to reopen very carefully. You can reopen all sorts of industries, whether it's restaurants, but you just have to do it creatively and carefully. So I don't want to give in to this pitting of privacy versus, because I don't think that's the way to go. I think that's a softer way to approach it. I think we just need to force creativity.
So this I was thinking about this and it came up as a question as well in the chat. Digital equity. And we talk about digital innovation, Carol, from a Canadian perspective and how important it is for us here. Not everybody has access to cell phones. And is there a standard that we can all agree on at some point? Because you've talked about what Prime Minister and Premier Ford are going to be releasing in terms of a Bluetooth-enabled contact tracing app. I know Alberta, because we did some work with Alberta, has brought the contact tracing app in from Singapore. I mean, is there a standardization? Is there, when it comes to digital equity, are these issues that, from a policy perspective, that we need to be talking about, particularly standardization? Because if you have one sort of app in Eastern Canada, a second sort of app in Western Canada, Korea has its approach. I mean, there's all sorts of different ways to look at this, but do we need to come to some sort of standardization? Is there some will and desire to do this, to make it happen in this way, that we all have something in common when we talk about this? I'll put that out there for both of you. So
I'm happy to take a quick run. I don't think we need standardization in contact tracing if you're applying a decentralized model, because the idea is that it's a model that's very localized to your particular device for a short period of time, and then it's gone. So standardization, ultimately, when you think about standardization, you try to think of a way to harmonize processes, ideally I always think of it as someone who works a lot in the field of AI, like, can we gather this data, harness the data for some other public good through the use of artificial intelligence? And in this case, the answer would be no. This is a very specific, localized app that is meant to do one thing only, and once it's done, it should be deleted, and in any event, nothing further should be retained. But when I hear you talk about digital equality, I think of it a little bit differently. So I think of it in terms of, well, what if you don't have an app? Or let's look at it from the other perspective. I have 2 young children, one of whom is school age, the other one will be school age next year. And the system so far has really, it's really failed these kids to accommodate. Okay, so the public school system has failed the kids to accommodate COVID. And in some ways, it's totally understandable because it all happened so quickly. But in other ways, the movement to virtual was very, very slow. But then you ask why. And part of the reason is because as part of the public system, there are lots of kids that don't have computers, and there are lots of kids that don't have Wi-Fi access. And that's the part that really scares me when I think about digital equity. I think about the people who need to get online in order to participate in what is becoming an e-world, and they can't because they don't have access to that. And that's something that requires immediate policy intervention and immediate government funding, because those kids can't get left behind.
Professor Park, thoughts?
I guess it's more fortunate for Korea on that side, because you don't need a smartphone to be tracked. As long as you are using a mobile phone, you will be tracked whether you agree or not. Because we are not using GPS. We are using cell tower tracking, and all mobile phones have a connection to cell tower. As to other aspects of digital equity, I'm working a lot on network neutrality, and Korea is a country where the internet access is very, let me say, not internet access, but internet access fees for content providers is one of the highest because of the dominating monopoly of telcos. That's something we should work on, but I think that takes a whole another seminar. If it's okay, I'll answer some of the questions directed me in question and answer. Is that okay?
That's fine. Go ahead.
Yes.
We have to be a little mindful of time, but we're getting close to the end.
Okay. Well, there is a very perceptive question that Korea National Intelligence Services has had a very bad track record of surveillance on civilians, and showed concern about mission creep on all this information gathered for COVID-19 purposes. I think my answer is that, well, I think it is fortunate that the progressive government is in power. The political forces that have fought with NIS are now in power, and we seem to have a greater trust with the system. Now, I know that that really doesn't answer your question, but taking that historical factor away, I think we are left with human rights question. And it's interesting how Korea's National Human Rights Commission has said something about public disclosure of data, but has not really spoken on this non-consensual, non-judicial location tracking. And your other question about STI tracing, if you can ask the question again, spelling out what STI means, I'll be able to answer.
Yes, I'm curious too. I have the question here, and maybe if you can just outline what STI stands for. Do you know what it means, Carol, by any chance? STI tracing? No. Okay. Well, I think, perhaps while we wait, if we only have a minute left to go anyway. So what I'd like to do is just basically say a couple last comments from both of you before I go into the thank yous and allow Consul General to say a few words as well. So Carol, any last thoughts as we bring this to an end?
Just one, and it's going to be very short, and it's a little bit repetitive, but there is no pitting of privacy against, okay? We are smart, we can figure it out. We are not going to give up on our core values. Lawyers love to talk about the slippery slope. There's good reason for this because there is evidence of slippery slope often. We also love talking about opening the floodgates for a whole host of things that can result. So we have to be cautious about how we respond. This is obviously an unprecedented time. So there will be measures that will occur today, but would not occur in the ordinary course. And we have to be very mindful about how we mitigate those measures once the ordinary course is done, once the unprecedented time is done. And have we defined what that looks like? Because we have worked very, very hard to build our values and our core constitutional rights and freedoms. And those are not things that we're going to give up on very easily. Great.
Professor Park, a couple of thoughts as we wind up.
I think Korea is in a very difficult situation where there's leaders from other governments are saying we'll follow suit, we'll take after Korea. But Korea has a very different system, and we are doing everything to keep to contain the outbreak, and we are being challenged to become the model country in fighting this outbreak. But only at the cost, only at some cost. I agree with Carol that yes, we can figure out a way to compromise, but there is inherent tension that there is the critical minimum amount of tension that we cannot avoid between privacy and public health. And Korean people, I guess, are fighting on behalf of the whole world this outbreak and showing how it's done, but only at the cost on themselves.
Thank you so much, KS. It was a great conversation between the two of you, and something I think we'll all benefit from. Consul General Chung, have you final thoughts that you might like to provide here?
Thank you for wonderful presentation and discussion, Professor Park and Carol. And the issue of privacy or public health is a real difficult dilemma for us, especially when we have to cope with it, COVID-19. And so today's discussion was really interesting to me and to give me a lot of food for thought. And I really appreciate it. And the one thing I want to add is the balancing between the privacy and the public health is really important. We cannot give up one thing. We can care for two at the same time. But regarding the public health policy point, the Korean government do not forsake all the privacy or personal information. We will take measures to prevent maluse of surveillance, private information. So I think both of us, Canada and Korea, can learn a lot of things from each other. And then, so that's why we need global collaborations, especially between countries like Canada and Korea, the leading country in coping with COVID-19. Thank you.
Well, thank you very much, Consul General. Thank you again to our speakers. You know, to be honest, this was an issue that we were facing, this whole issue around artificial intelligence, AI. Canada is a leader in this particular space, machine learning. This is something that was facing us even before we had the COVID crisis. We now have the global partnership on AI, which Canada was at the front end of this, and now we have 15 countries participating in it. It's all about how we work on this together, because you know, the digital platforms, the digital space is not going to go away. Carol, you made the point that really how we move forward in an e-world is going to be really quite critical. And so for Canada, this is important. So having this conversation, KS, you and Carol, it creates all sorts of legal issues, but there are issues we have to face and we have to come to some sort of agreement on. So again, fundamental theme is collaboration, understanding that we're all in this together to defeat something that is really bigger than all of us together. So it's a real challenge for us. And I just want to thank you for taking the time to spend and have a conversation with people. And I hope there are many questions we haven't answered. And we just, again, it's always a function of time, but we will try and maybe farm them out to you. We can address them at a later time. So this, again, for people, this will be on our website, so you can come back and look at it. And again, thank you very much for taking the time today. And I wish you the best of success going forward, and stay safe and healthy. So thank you so much.